All right. Discussion number 5 concerning the guy who fell from the scaffolding. You have the safety officer come up to you, and the first question that they want us to discuss is what other information about the mechanism of injury should the paramedic have tried to obtain from the site manager or patient? Well, first of all, you want to know did anybody see him fall? Did they see how he landed? Did they see what he landed on? Did he land on a bunch of rebar? Did he land on a bunch of brick? Did he land on some pillows at a pillow factory or a mattress? Whatever. I mean, it could be anything. He fell on from some scaffolding. Did he land on just loose dirt, hard concrete? To try to kind of determine the mechanism of injury. How high was the scaffolding? How high did he fall from? That's another thing that we want to know. And do we know if he hit anything on the way down? Did anybody see it? It's kind of the big thing. We know that he's kind of saying that he doesn't want to be treated, not giving us a whole lot of information, and that might be a couple of things. So, was he wearing a helmet when he fell? That was another one I wanted to mention. So those are some questions that we want to look at to try to determine the mechanism of injury. How protected was he? How far did he fall? What was his, how fast was he going when he hit the ground? How fast did he stop? All those types of things that we look at with blunt trauma, car wrecks, falls, all sorts of things like that. So what type of traumatic injury does the patient have? We're going to assume blunt because from what I know, we haven't stripped him down and seen that, he's been stabbed or something like that, who knows. But blunt. Do you believe the patient should be transported and why? I say yes, he should be transported because unless we get that information, we don't know really how severe his symptoms or how severe his injury is, depending on the size of the hematoma, depending upon any crepitus that we might feel. Is it do we have? There's a lot of different things. Does he have? Does he have any other underlying internal injuries? If he fell from a certain height, there's a lot of things that can go on, not just with hitting your head, but with other injuries. Seems that he's intoxicated, I guess. You smell alcohol, so you assume he's intoxicated. I don't know that we can prove that, but we take that into account when we're trying to make decisions based upon how they're reacting to their symptoms. Because he could be inebriated, he might not be reacting to something that happened because he's not able to, or because his body just isn't reacting because of the impairment of the alcohol. So I would say, yeah, if he has a concussion, if he has any underlying issues that you don't know about, because he's not completely coherent, possibly. If he's not coherent, then definitely, yeah, you're going to take him. He also could have anterograde amnesia, where he doesn't even remember what happened, and so that would also be another sign where he's got a pretty traumatic brain injury, and you want to make sure that that gets taken care of, and that he's monitored overnight to make sure that there's no other issues that come about. When should stabilization occur? When you get on scene, you can hold manual stabilization with somebody who's standing, with somebody who's sitting, with somebody who's laying down, and just go ahead and tell them, hey, let's sit still for a second, let's check you out. Obviously, he wasn't complying, but whenever he did comply, at that point, you'd go ahead and say, we need to maintain your spine because unless somebody saw him fall, you don't know what caused possible cervical injury or cervical, yes, spinal injuries he might have. And then once you get manual stabilization until you get into the ambulance, and then go ahead and transition over to a seat collar when you can do a secondary assessment and different things like that. If you assume that there's some possible really bad stuff going on, you'll want to get him moved to a hospital because there's nothing you can do for those internal injuries there. And so getting him to a hospital where he can be treated if he does have anything. What are at least 3 injuries or medical conditions that may have led to the fall or been incurred as a result of the flow of it? He could be drunk. That's a possibility, and that's caused him to lose motor skills or his coordination, where he might be fall. With an older age, we'd think, okay, possible loss of coordination just because of old age, or maybe even eyesight failing. But it says that he's a middle-aged male, so we assume that that's not any of it. That could have caused it. So whenever they fall, you have fractures along the skeletal pathway. So you fall on your feet, you have possible ankle, thigh, pelvic fractures that can occur depending upon how hard and how fast they stopped. You can have spinal damage, spinal compression that can occur from that. If he tries to catch himself when he falls, you might have wrist, shoulder, or clavicle fractures. Also, depending upon how far he fell and what he hit when he went down, he could have that rapid deceleration could cause compressed, displaced, or even twisted internal organs uh, that would cause a lot of issues that need to be looked at and examined to see what effects that's going to have on his body. So that's kind of what we got with this man, checking him out and seeing what's good for him.